Hello, everyone, and welcome back to the Tuesday edition of the Pat and Mike Show. We have Dr. Katie Hinderer back on to kind of give us an update of, I know she was on the show maybe a couple months ago. Let's talk today about, what's the current state of COVID and what's happening as we all return to work. Some of us are going to school. We might touch on that a little bit, but we'll see how that goes. And again, a little introduction of us. I'm Michael Rutkowski, Estate Preservation and Asset Protection Attorney. We got Patrick Carrier above. He's with the firm as well. And Katie, why don't you give us a little bit again on you and the practice you're with?
Sure. So I'm an internal medicine physician. I practice up in Clarkston, Michigan. I'm part of a large group called the Clarkston Medical Group, but I'm also affiliated with a national company called MDVIP. MDVIP is a national affiliation where with this type of practice, we downsize the number of patients that we have. So where most practices traditionally have quite a few, even thousands of patients, with MDVIP, physicians typically have in the hundreds of patients. So that means longer appointment times, same day, next day appointments, ways to get in contact with your doctor after hours and on weekends directly if needed. And we also have a nice wellness program that we do where we do some additional testing that's not routinely done with a typical physical. So it's a really great program. So if anyone wants any more information, please reach out to us and we can always set up an appointment to do a meet and greet where we kind of discuss the program in more detail, or the receptionist to our office can also give information. MDVIP also does have a website, just mdvip.com. And there is more information there as well. So those are some kind of good resources to look at. But yeah, if anyone's interested, we'd be happy to give some more information.
Beautiful. Thank you for that. And I know that we've worked with plenty of families that have utilized your services, and I think they would give it a 5-star rating. So it sounds like if you're looking for some of that additional time in the office or just a little bit more care, please reach out to Katie in her office to schedule an appointment. So let's jump right into it. And what are you seeing right now? Are you still doing testing? What does testing look like these days? Kind of give us what is your world like besides trying to figure out how you're going to school your kids at the same time?
That's right. So we right now, we are still doing testing through our main office down at the Clarkston Medical Group. We still are running an outdoor testing unit. Never would have thought 5 months ago that we would still be doing this, but we are. So any patients that have symptoms suggested of COVID, patients that need testing for surgical procedures, which has also been something that's been commonly done, patients who need testing to go back to work or have had exposures, we are still doing an outdoor testing unit where patients make an appointment, but they do pull up in their cars, a physician or a provider, a PA or nurse practitioner, come out to the vehicle, see the patient, get kind of their history. We can check vital signs, listen to heart and lungs, things like that if needed, and then perform the test. The test is still done with a nasal swab, and that's checking for current or active infection. Those results typically are taking approximately 2 to 3 days to come back. Sometimes, depending on if they're done on the weekend, it can be like more 3 to 5 days. We have had sometimes with different labs, because the amount of tests that are being run now, where tests have taken over a week to come back. So that is one thing that's not still ideal, but for the most part, within, I would say, 3 days, we typically will have those results back. We're still running that unit. We're definitely seeing, I think, less patients who are truly very ill with the infection, but a lot of people with potential exposures. Like I said, a lot of patients who are going for elective surgeries, they're requiring COVID testing prior to that being done. So we're testing a lot of patients for that. In some places to return to work, they're requiring.
Yeah, I was going to ask that. I feel like I know a lot of people that have been tested just as a step in returning to the workplace.
Mm-hmm. Yep. A lot of the nursing home employees, they need to be tested. I believe it's once every 2 weeks. So there's a lot of, we're going in and doing a lot of testing in nursing homes, checking the residents, checking the employees. So that's kind of been a lot of it. So we're still doing a lot of testing, in Michigan. It seems now they're running at least like probably about 20 to 25,000 tests per day, which is definitely ramped up from where it was at the beginning. But we're still running our testing unit. So it's, we're preparing for the winter when the weather turns and we're still outside and it starts to become cold, and how that's going to be handled. But because we're trying to keep people who are at all sick out of the office to minimize exposure, we feel it's important to have that unit up and running so that patients can still be evaluated without the potential of exposing, healthy patients who are coming into the office as well.
Okay.
Maybe get some of those kind of outdoor beer garden propane type
Yes.
heaters.
We have propane. We have a tent. We have now
Okay.
more of a permanent structure. We had kind of a trailer, and that's now been removed with more of a permanent structure that's out there. So
Great.
we're definitely kind of adjusting. It's been rain, snow, hail. Now it's hot. So there's been all sorts of weather that everyone's dealt with that.
So walk me through. So I have not been tested, fortunately,
Yes.
I guess. Walk me through, what does it look like to be tested? I mean, I'm picturing if the state's testing 25,000, it's like a lineup of cars, like the longest McDonald's drive-through you've ever seen in your life. And you just kind of go through, and then I also hear that they stick something quite far up your nose. So you just kind of get that done as you're kind of driving through. Is that what's happening?
Through our office, we actually have patients schedule appointment times so that everyone has a time slot, which is nice. So you're not waiting for a crazy amount of time. So we give you a time slot, you drive up, somebody will come out to your car, wearing the appropriate PPE with mask and eye protection, a gown. We ask that patients wear masks when they pull up as well. We'll ask some of the history of why they want or why they need testing. Check some basic vital signs. We have the thermometers that can do the scan on the forehead, check an oxygen level, with a pulse ox that goes on the finger, and also get the heart rate. And then the swab does go up into the nostril. It goes on both sides. It goes pretty far back. It's not very comfortable, but it is quick. Patients often will kind of get a little irritation. It can make you cough. And then we just send that specimen out. So that's looking for like a current or active infection. And that's the best way to be screened. There are other antibody tests that we're also doing. So an antibody test looks, the main antibody that we're looking for is called an IgG antibody, and that's looking for past exposure or infection. Those typically become positive between 1 to 3 weeks after an infection. So they're not really used to diagnose an acute infection, but we use those mainly if someone maybe was ill and had pretty typical symptoms of COVID. But when we did their swab, it was negative. That can be helpful. We do that if patients who had documented COVID infections want to donate plasma, which is something that's been used for treatment. They have to have antibody tests showing that they have the antibody prior to that being done. Sometimes family members who maybe someone in the family got sick, the patient never really developed any symptoms. Antibody tests can be helpful to see if potentially they had enough exposure that they developed antibodies. So the blood, that's a blood test, and that can be done as well, but that's not for an acute infection. There are some places that are doing more rapid testing, checking for an IgM antibody, which is more recent infection. That's not really standard of care and not recommended. So really the nasal swab is what we're looking at. There are some talk that there's some newer tests coming out where there'll be saliva tests. That's a more rapid test that's come out. As I've seen right now, we're not really running that here, and I haven't really seen anyone using that. But there's going to be a lot of, people trying to get quicker test results back. The hospitals typically have more rapid tests they can do using the nasal swab, but they can get the results faster because obviously if you have a patient who's critically ill and in the hospital, you need to know if they're positive, to know how to isolate them and what the next step is for treatment. So the hospital tests typically will come back a little bit faster, but through more of the private labs that a lot of us are using, it's taking a few days to come back.
So certainly anybody who's symptomatic or showing signs, it would be a good idea for them to get tested.
Yes.
And then we've got folks, as you're saying, sorry.
Nope.
I didn't mean to talk over you. I was just saying also, and then certainly folks who require it to go back home or to go back to work.
Yes.
Is there anyone who you would advise, someone who's asymptomatic, what sorts of questions should they be asking themselves? Because it's not the simplest thing in the world. I mean,
Right.
it's invasive and not like, I mean, it's going up there.
Right.
So what would you say people should be thinking, if this is going on, I should get tested?
I think if anyone who has any symptoms that, in the symptoms it seems like this is something that's changing all the time. So, people can have, initially it was fever, shortness of breath, cough, but sore throat, nausea, vomiting, diarrhea, loss of taste and smell, severe headaches, fatigue. So if anyone develops any sort of those symptoms, there's even rashes that people can have with COVID, that if anything's new or different, right now you should be tested. There's no reason not to get a test that can, be done. And if we have any suspicion, they should be tested. Patients who have had definitely an exposure should be tested, because even if you're not symptomatic, we really want to make sure that, you're not potentially spreading it to other people. People who are returning, to work, some places are requiring those. One thing we have to remember is that the test is only as good as the day you test. So, like, let's say you're going back to work in a week, you can test it on a Monday and it's negative. That doesn't mean you won't test positive later, or that you could be, contract it later on that week. So that's the one limitation of testing. It's only as good as that day you're getting the test. So that's one thing we have to remember. We have had patients who are, negative, and if they've continued to have persistent symptoms, that sometimes we have retested them to see if they do turn positive. And we're also telling patients, none of the testing is perfect. So if you have pretty consistent symptoms, even if your test is negative, you should still quarantine at home until you're feeling better. That's changed as well too. Now they're saying at least 10 days, from the onset of symptoms and before you can go back and be exposed. 10 days, no fever for over 24 hours now is what they're recommending, and your other symptoms are all improving. And I just checked that yesterday. That's a new update from the CDC. Initially it was, 14 days, 3 days without a fever, but everything's kind of evolving. This is something that every couple days guidelines are changed and updated from.
And I think that, sorry, and then I'll let you talk, Mike. Sorry. But I think that's something that is really, really important to understand on this. With something like a disease or with science, it's an evolving issue. As new information comes forward, things change. And I mean, we do the law, and you can go to a statute, you can go to a rule, and you can say, hey, this is exactly this, because that's what's written down. When it comes to science, when it comes to illness, there's a lot more that we don't know. And so it's it's an evolving thing, I guess, which is why kind of so important to stay up on how things are changing.
Absolutely. I mean, it's changed, constantly. We've had so many meetings, so many talks. There's so many things to stay, updated on. And I think, I know everyone wants a really firm answer of when this will be done and when things will be better. And we just don't know yet. It's going to be some time. We are in the middle of a pandemic. The entire world is facing this. And, there is not really any great answers. And we're all kind of learning as we go, unfortunately, as we try to kind of navigate this and trying to keep everybody as safe as possible. The wide range of symptoms that patients can have is also a little tricky. The fact that some people could be asymptomatic and some people can be so ill is difficult. And the fact that sometimes we have, older patients who actually end up doing okay, and then we have younger patients who get quite sick, and there's not really any rhyme or reason to know who that's going to be. So trying to protect everybody is definitely important.
Katie, question for you on, what we know now as of like how this disease is spreading and that. I know we've learned quite a bit. I mean, I get my information from the very reliable sources like Facebook, Twitter. I mean, that's how the general public gets educated these days. So what can you say to our listeners about, like, is it transmitting through contact? Masks, I know, are super important. What have we learned in the last 6 months about this?
Sure. So I think, there's still something about, it lasting on surfaces and things like that. I think they've started to kind of shy away from those guidelines. When initially everyone was wiping off their groceries and worried about that. definitely good hand washing. When you leave the grocery store, wash your hands, use some hand sanitizer. I don't think it's a bad idea to wipe off your grocery cart that everybody's been using, but I think it's less concern about it like living on like a package or things like that. It's definitely the respiratory droplets. So when you're around people, to be, try to stay the 6 feet distance for some social distancing and to wear a mask. So masks are really important. And I think that's really what's going to help reduce this. They said, I think if everyone wore a mask, we'd reduce our death rate by like 30,000 people, if people would just wear a mask. So, we can use the surgical face mask or a cloth face mask. They do.
How much difference is there in masks? I mean, is it okay for someone to just like do one of these?
It's better than nothing, but I probably like something that actually covers, with, a surgical face mask. Even a cloth face mask is fine. They do say the ones with the valves are not great because although that protects the person who's wearing it, their respiratory droplets can still go out through that valve. So any face mask with a valve should actually probably be covered with something else. But a cloth face mask, a surgical face mask, and even at kids wear, I know everyone is concerned that kids can wear them, but I mean, I've had to take my kids to the dentist, the pediatrician, and, kids are better than we think. They'll wear them. They may.
Isn't it funny how like our kids are being raised? Like my kids know now they get out of the car. It's like,
where's your mask?
They just know.
I ordered a whole bunch more masks for my daughter, different designs and things like that. So I think masking, especially when you're going to be with a large group of people or you're going to be indoors and you can't practice social distancing, wearing a mask is probably our best sort of protection. The other thing they're really stressing this year is that everyone should get a flu shot because when flu season hits, it's going to be very difficult when we're also, dealing with COVID and then the flu, knowing what's what. So wearing a mask will be very helpful during that time. Washing your hands or using hand sanitizer and getting a flu shot to protect yourself from the flu is also very important this year.
Yeah, I was going to say those, a lot of that seems like just a general good best practice as well, for safety. But as flu season, cold and flu season comes on, and talking about how this is, we don't know what we don't know yet. I mean, there are definitely going to be people who have both. Who will have COVID, who will have the flu, who maybe even have, rhinovirus or something else as well. And who knows what that impact will be. So kind of as we're moving into that phase, getting comfortable in those habits and those practices to protect the people around us. Right. I mean, more even so than ourselves, making sure the folks around us are safe.
And that's the big thing about wearing a mask. I mean, a mask doesn't necessarily protect you, but it protects everybody else. Because if for some reason you have it and you're asymptomatic, wearing a mask reduces the spread. I mean, they say the best thing, if 2 people are wearing a mask and are in the same room, the risk of transmission is very low. So that's the biggest thing. I've had a lot of patients ask me, well, what's safe to do? Anything outside is better than things that are inside because you're farther, can be farther apart, the air, you're not in an enclosed space. If you have to be close with people who you're not living with or aren't close, that you should wear a mask. But anything that's outdoors is definitely better. So that's why I keep telling my patients, now's the time. If there's something you want to do, you can sit outside with somebody. Sit 6 feet apart if you're not comfortable wearing a mask, and enjoy those outdoor activities now while the weather is still nice, because it's going to definitely become a little more difficult once the weather turns for the winter.
Certainly.
Great. Well, Katie, we really appreciate your time. That's great information, much better than where I get mine. So now I feel more educated on the subject, which we all should do. Her contact information is right there if you'd like to schedule an appointment to meet with her or any of her colleagues, or if you feel like you should be tested. They're running a great facility up there in Clarkston, and it doesn't sound like it takes all that long to get in there.
Yeah, and I'll give you the testing number too is 248-384-8323. So if anyone needs to be tested, that's the number you would call to set up an appointment. We also have a dedicated line for Oakland County medical first responders. So, police, EMT, military, and that number is 248-384-8326.
And who would call that line? Like
so anyone,
RF frontline
so police, EMT, military, anyone can call that line, and we can also set up testing as well.
Okay, and then maybe that gets you priority testing or something.
It helps. It's a dedicated line, and some of that stuff is, I think, help funded differently through the county. So
great.
Things they can call that number as well.
Perfect.
And one of the things, because Mike and I aren't doctors, we're lawyers over here, and so one of the very few things that we can do to help out with this, I've had several calls this week, including someone who I spoke to right before this, kids going back to college with medical powers of attorney, that kind of thing, because parents are concerned about what's going on with their kids, especially who are out of state for the first time. And you can't talk to the parents of an 18 or 19-year-old kid if they call without their permission. So that's, a little thing that we can do that can make a big difference for a lot of these families who are sending kids off for the first time. Because when they hear a story on the news about what's going on, maybe even at the school their kids are at, they might have questions for the doctor, or if they can't get a hold of them. So, just to make that point.
For sure.
Yeah.
Absolutely. So we can help with that, and Dr. Hinderer can do the rest.
She can help with everything else. Yeah.
Oh, hopefully.
All right, Katie, thank you so
All
much.
right, thank you.
Appreciate everyone tuning in, and look forward to talking to everyone next week.
All right. Take care.